Hi, my name is Steve, and this is my Pico presentation for evidence-based practice. And right here is the overall look of my board, and I will get closer so that you can see each of the areas, and I will discuss it further. So the title of my project is Confuse and Improving Confusion Assessment in the Hospitalized Adults. My PICO question is would nurse my PICO question is would nurse education and identify patients at risk for delirium with the use of the confusion assessment method, which is known as the CAM tool, improve nursing understanding of on the delirium and potentially improve the patient outcome. My background for this project is that I currently work as a post on surgery nurse, and on a very routine basis, we will get a lot of the elderly patients that come in from having a previous fall that might be getting their hip or their knee done. And lots of nurses, have voiced the frustration of having to take care of the confused patients and that, they don't have the proper interventions needed to to provide the patient safety care. But 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 also there are a lot of nurses that don't know the difference between the delirium or on what might be the patient's norm for confusion or the dementia. I went on and put some objectives, just of what I hope that people might get from my project. To be able to define the post-op delirium, and maybe learn some proper interventions to improve patient safety. I went on and put some terminology in the center of my board, as well as some other just common information to help people better understand some of the terms that I use and methods such as the the confusion assessment method. So right here I have the terminology for confusion, dementia, and delirium. I have some of the I have some of the features and the predisposing factors and the precipitating factors for delirium. The main one right there is surgery for why I chose this topic. And for I also put this to for the confusion assessment method for people that aren't familiar with it. And it's just a standardized evidence based tool that enables those that don't have a background in psych or are not familiar with delirium and confusion to be able to identify patients at risk and try to provide the proper interventions. And and right here, I provided the information for the confusion assessment method that they use to score people. And you can mainly see that they're looking for the patient's behavior and how they're acting. And these are the features. And for the diagnosis of delirium to be made by the CAM, this requires the presence of features 1 and 2 and either 3 or 4. And I also have just a daily on delirium assessment that you might see in the hospital. This has the different physician orders, such as labs, maybe some consults that might be needed, such as to physical therapy or case management. And at the bottom, you can see that they also have the recommended meds that we might give somebody that's experiencing the delirium, such as the Halidol and the Risperidone. I also just put some of the interventions up here. The treatment of delirium, that starts from the time that they arrive at the hospital to the time that they are in surgery. We are trying to keep them the hemodynamic. We're trying to make sure that their electrolytes are within normal limits. And then some of the specific care that should be taken to avoid is dehydration or the hypovolemia, because this can cause the delirium to get worse. and then also such as the non-essential catheters, such as Foley's and Angie's tubes. These were the results for my main article that I used. Out of a possible 635 patients, there were 96 that were included in this project. And the reason that there was only 96 included was because the article only chose people over the age of 65 and that they had to come in for an EO elective surgery. And there were a total of 91% of nurses that had used the CAM when they were assessing their patients, and the ability to detect delirium increased, and they were able to identify the 13% prevalence of the post-op on delirium compared to 8% from the previous year. And that these patients tend to have a longer hospital stay, a greater